Hey, it's Dr. Jaban. Have you ever seen high iron, high ferritin and wondered why? Have you seen anemias in iron and ferritin that just never seem to resolve? You can take supplements and maybe it'll go up and then it'll drop. Or maybe it just doesn't go up. I've seen people get infusions over and over and over again of blood and iron and it still always drops back off. I'm going to be talking about some reasons for this so that we can help you with your iron anemia deficiencies, your tiredness, your chronic fatigue, your even digestive issues, and give you some correlations of why these things might be happening. So, first of all, an elevated iron can be from so many different reasons, and I've got my notes up so that I don't forget about these things. So, it can be from a B6 deficiency. This means that just a B vitamin deficiency is there, and then your body's ability to process iron isn't going to be right. So you need to be checking, even with that, you need to be checking your liver enzymes, your AST and your ALT. Liver damage can cause iron to elevate. This is something where your body isn't processing the iron and it starts to increase due to inflammation because the liver isn't working right. You can have hemolytic anemias. You can also have a lot of other difficulties just with lack of detoxification, so your body isn't cleaning out, right? So that's elevated iron. Now, that's less common than low iron, but I'm getting through these elevations first before I jump into the reductions because those are something that are a little bit more common. So ferritin is a storage of iron. It is in your body. It's your savings account for iron, right? So if you see an elevated iron or an elevated ferritin, here's some reasons for it. Liver damage, inflammatory disease. So if you are inflamed, ferritin's going up. Now, I've seen this. I saw this today in some labs that I was going over. And that just is a big signal for me. Okay, we've got inflammation. I don't care if your C-reactive protein is low, your homocysteine is low, both blood tests, your SED rate is low. If you have an elevated ferritin, that's a great possibility right there. Now, something else that could be there is you could have it elevated so high, it could be something called hemochromatosis. Hemochromatosis means that your body has an extremely high ferritin level, way above the normal, so almost double your normal. And this can lead to fatigue and toxicity all on its own, so that's hemochromatosis. Now, other reasons for ferritin being elevated is going to be another hemolytic anemia, meaning that your red blood cells are having damage, right? So they're dying off, spewing out their iron. Now, those things that are happening there, again, that's not quite as common as the inflammatory reasoning, but it's definitely there. Now, let's go back up. Let's talk about iron when it's low. So low iron can, yes, be from not intaking it and not absorbing it. Why wouldn't you be absorbing it if you are intaking? Well, do you have Crohn's, ulcerative colitis, IBS, functional abdominal pain? Do you have anything going on with the digestive tract do you feel cramping, bloating? Do you feel like you don't process food well? Food sits too long. You probably have a poor absorption problem if you have any of that going on. So you've got to get that taken care of before you're going to get your iron to increase. I know there was a comment on my post that said that someone had been taking iron and it didn't go up at all over a couple of months. Well, absorption's bad. Why is absorption bad is where you need to be looking. Do you have parasites? Do you have some sort of bacterial infection? Because by the way, iron is like chocolate for a bacteria. They love it. They want to tear it up. They go after it. So if you are having a low iron constantly, be thinking about, do we have a bacterial infection going on? So that's a big piece. There's also decreased iron can be from birth control. So progesterone birth controls have shown for a decrease in iron. All right, so then what about low ferritin? Low ferritin comes from very similar reasonings because remember, iron and ferritin are similar. Ferritin is just the storage, right? So do you have chronic blood loss from menstruation, from a GI bleed? This can go both for iron or ferritin. So also, it is thought that you have to see occult blood in the stool to have bleeding. That is not totally true. I have seen people that have no blood in stool tests, none at all. Yet, once we go through and treat the gut, get rid of the leaky gut, all of a sudden they stop having to have blood transfusions. Yes, I said blood transfusions. I'm not talking about just getting in iron. I'm talking about blood transfusions, which takes their hemoglobin, their iron, their ferritin, their red blood cell count all up. So gut has a huge portion to play in this. Now, also, ferritin can be decreased from chronic disease, chronic infection, poor absorption, and intake. So same types of reasons as iron. But let's talk about this. So I mentioned that bacterial infections will like to eat up iron. What else does? Well, if you have parasites creating damage in the gut, then you're likely going to have a low iron because you're not absorbing and you might be bleeding a little bit. Celiac disease, so allergens, food allergens, celiac specifically gluten is an issue, but food allergies in general create a collateral damage of your colon, leading to potential to have leaky gut and bleeding. So these are all pieces of the puzzle for you to understand if you're trying to get your iron into a normal state. So remember, if we're going to make this really simple, if ferritin and iron are low, you're not absorbing it for some reason, likely infections or toxins. If your ferritin and iron are high, either you're supplementing in too much, you're too inflamed, or your liver needs some kind of support. So that's your basics. So then what do I do with this? If you're high, I'm immediately going to go in and support detox pathways, and I'm going to immediately go in with some anti-inflammatories. Those are the immediate steps. Then we're going to go after that cause of inflammation, take it out so that you can suppress. If you're low, then immediately I'm going to go in and try and heal absorption. So I'm going to use something called Reparavite. Reparavite's an Apex product that we use all the time. It's got glutamine, it's got slippery elm, Spanish moss, we've got aloe, zinc, and a few digestive enzymes in it. Phenomenal product. I've heard it called liquid gold so many different times because it calms the digestive tract. We're going to use Histidio. We're going to use a product called Gluten Flam, which is more of a pill-based type Reparavite. And those things are all going to go in and help to solve some of the inflammation and start healing the digestive tract. Now, from there, you've got to get rid of that root cause. So get rid of your parasites and bacteria so that it doesn't just continue perpetuating itself forever. So there you go. That's the meat of ferritin and iron and how to work with both of those from an idealistic perspective. I know I didn't give you an exact protocol, but for an exact protocol, I got to know your symptoms, your history, and everything else. So if this is something you're dealing with and you have more questions, post them below. If you know somebody that is dealing with chronic inflammation, chronically low or high ferritin or iron, tag them to this video so they can get a better understanding, and this might take them to that next step so they can continue their healing journey. Remember, there is hope in healing. I can't wait to do the next video for you guys, can keep educating you. So give me some more ideas. I know I've got a stack of ideas that we just asked for recently. Thank you so much for that. Have a great night, everybody. Bye.